Okay, so the first question, which I had received a little while ago, was, what do I think about O'Sullivan in cognitive functional therapy? I think the idea of trying to assess the pain that has gotten out of control by people is an important part of what we should do in our assessments of individuals. I think in some ways the availability of radiology, where people see more about injured tissues and then are treated with things like opioids that produce secondary effects, has made this kind of assessment particularly important in this day and age. The first part was that clearly people have recognized the importance of pain science, and that being aware of how to assess people for when their perceptions or their pain has overridden whatever tissue problem they had is an important aspect of practice. I've reviewed the literature, and I've had discussions with many people, and what needs to be kept in perspective for all of this is what % of the patients that present themselves to a physiotherapist are afflicted by this exaggerated pain response. And it's in the neighborhood of 15 to 20% at the most. I think that group has always been with us, and I think what's important is to recognize how best we can deal with it. And there's one other aspect to this, and that's what I was trying to present in this material, is that with our examining how people move and what causes them pain, and how to show them how not to elicit pain with their movements, that will put the patient in charge of their pain, and it won't be so frightening. And if we start that from the beginning, before they've become so fearful that every movement will hurt, I think we can reduce this pain that becomes out of control. I think the second part of this question was how to integrate kinesiophobia concepts in with the movement system. And I want to talk about a specific study that Linda Van Dillen and her colleagues did. And this study was a study where people stood for 2 hours, and about 28 to 42% of the people developed back pain. These people were given the test for kinesiophobia before they started to do the standing paradigm. And in this study, what they found is that if you had a high kinesiophobia score, you did not necessarily develop back pain. But if you develop back pain, you usually rated it at a higher level than those that had a lower kinesiophobia score. And then the other question was, how do you correct movement without discouraging movement? And I never discourage movement. What I do is we teach people how to move so they don't have pain. In fact, we enable them to move rather than discouraging any kind of movement. And I think I'll just reinforce that that's why it's so important to appreciate it's the way you do your everyday activities. And that's what needs to be corrected, like how you roll, how you go from supine to sit, how you walk. Correcting all of those keeps people moving, and it puts them in charge, which is the really important aspect. And then another question was how to avoid nocebo. And to me, I'm always positive. I always believe I can help the patient. So if anything, it's creating a more view of success, and not to worry. We're not going to make it worse. We're going to make it better. And I know how, and we're going to help you know how to fix yourself.